Gynecomastia, if you look at there are two parts of the word gynecomastia, gyne and mastia. So the gyne is female and mastia is a breast. So when the breast of a male looks like a female breast, then it's called a gynecomastia. I think it's a Greek word, which is which is a translation of that is male, female-like breast. So that is gynecomastia. The gynecomastia can be due to many reasons, but the most common presentation of gynecomastia is the reason is unknown. Most of the time, the patients are young and it can start from teenage when they see that there is an abnormal appearance of the chest. And they are really concerned with that. Most of our patients for gynecomastia is an aesthetic reason when they don't like the chest shape, especially when they're wearing a shirt, it's pop out from the chest area that looks really bad. When they go for swimming, they are very conscious about the appearance. And when they are meeting with friends, and sometimes some young children, they develop it and they get bullied in the school, which is psychologically impacted as well. There is a rare reasons for gynecomastia, which are more serious, but they're quite rare, that also should be excluded, which has pathological reasons of enlargement. So, there are so many reasons where the gynecomastia can be classified as, which can be predominantly, it can be fat, or it can be the gland that is normally it's a rudimentary gland in male, but that can enlarge and looks like a female breast. So if a male chest appearance looks like a female chest appearance, which is a gynecomastia, and it causing pain, discharge from the nipple, abnormality in symmetry, hard lumps, or any abnormal findings, and that should be investigated. So blood tests can be done, ultrasound can be done for the chest area, and further investigation to rule out a secondary cause in other organs and another part of the body should be excluded in severe cases, So most of the gynecomastia are surprisingly idiopathic, which is the cause is not known. They can advance from smaller shape and size to the largest shape and size. It really depends on the patient. So it's not the course of gynecomastia is variable. For example, if it's related to the weight, which is we often call as the pseudogynecomastia, and then the weight is increasing, the breast size is increasing. In some patients, they are very healthy and fit. They still have very predominant gynecomastia, which is probably predominantly the gland which is enlarged. And so, in those cases that they need a treatment and to stop also the advancement of the size of the gynecomastia. So if you leave it, most of the time the patients, they have it for many, many years. In majority of the cases, it doesn't lead to something really serious. A very small amount of gynecomastia can lead to some serious effects like breast cancers and all that. They are very extremely rare. In my career, I've done a lot of gynecomastia. I've really not seen anybody, to be honest, have advanced to that level. But we do have people who have other conditions that required an urgent treatment in gynecomastia. So that's a very good question. So we need to always see the underlying cause. If the gynecomastia is secondary to hormonal imbalance, then it is important to check the hormones level. And sometimes the female hormones in male is high, and that is causing the gynecomastia. Bottom line, the gynecomastia does require treatment in most of the time, where a simple liposuction, a gland excision can be performed, in which when the gland is removed, either the gland can be checked for histology, or most of the time it's very obvious gynecomastia that does not necessarily require a histology. You can always involve the patient, discuss if they are worried about that gland, we can always check it. Um, if leave if you do not treat the gynecomastia, and actually the gynecomastia is graded as different classifications of gynecomastia. So gynecomastia in a journal grading is from grade 1, 2, 3, 4. Like it's an advanced gynecomastia, which goes, and treatment is different from the basic gynecomastia, which are small to medium size, where a liposuction and gland excision is possible, while the gynecomastia can go bigger and where you need to remove fat, gland, and also part of the skin that can be loose and hanging to get the shape. And some people, they have massive weight loss, and the gynecomastia is appearing like is really laxed and require excision of the skin, removal of the skin, and reshape it. And sometimes we even have to reshape the nipple and the areolar part. So it really depends on the grade of the gynecomastia. The treatment of gynecomastia depends on the type of the gynecomastia as well. And also if there is any suspicion of any underlying medical condition that has to be excluded as well. Gynecomastia is not life-threatening, honestly, unless you are suspecting a malignancy in it, So if there is no malignancy, it is not life-threatening. Gynecomastia is an appearance and more of an aesthetic reason for the treatment in majority of the patients. By saying so, it does have an effect on a mental well-being of a patient, especially the male patients or younger age group. It is really important for them that their chest doesn't look like a female, So that's probably would interlink with other issues of mental well-being, but we talk a lot about the mental well-being nowadays. So I think that's probably one of the strongest reasons why gynecomastia needs treatment. But it's not, in my opinion, not really a life-threatening thing directly, like any other medical conditions.